Gurmagat, I'm sharing time as well, I think, with Dr. Riley. Can I, first of all, in what will be my last contribution in this House before Christmas, I want to wish the Minister and his family a very happy and peaceful Christmas, and indeed all of the staff in the department and those in the HSE, and take the opportunity, Cathaoirleach, to sincerely thank all of the frontline workers, all of those who work in our acute hospitals, in primary care, in mental health care, in community care, but also in our nursing homes, who have done a really, really difficult, challenging job, but done Trojan work over the last number of months in what has been a very, very difficult situation. And I start, Minister, by I want to commend Professor McGrath for his work, and indeed all of the expert group. I'm on record as saying that the plan that they have produced is not just a credible plan, it's very good. It's a very good framework. But I suppose, like all plans, it comes down to resourcing, and we have to look under the bonnet of the plan to see how well this plan is going to be resourced and how quickly this plan can be delivered if and when any of the vaccines get approval from the European Medicines Agency, and we hope that will happen as soon as it is safe to do so. It's important as well, Minister, and I say this sincerely, that we don't unrealistically raise anybody's expectations in relation to the vaccine. And I don't say that as any criticism of yourself, I say that as a general point, that we really need to be honest with people in relation to how quickly the vaccine will come on stream. It is possible that the European Medicines Agency will sign off and approve any number of the vaccines before the end of the year or early next year. But it was very obvious to me in the Health Committee this week that even with the advanced purchase agreements that we have with multiple different pharmaceutical companies, totalling over 14 million doses of different vaccines, the most likely candidate, we are told, for first approval of a vaccine will be the Pfizer-BioNTech vaccine, and we're in for 2.2 million doses of that particular vaccine. But we were told only 5,000 of those doses will come in the first phase, and then a couple of 100,000, but no more than that. We weren't even given a figure of what a couple of 100,000 will mean. Is it 200,000, 500,000? And my point is, we don't know how quickly the supply of the doses will come, and that will determine how quickly people will become vaccinated. So I say that in terms of not raising people's expectations, because we have to be careful and we cannot be complacent. And the Minister quite rightly pointed out that the positivity rates in this state are increasing. The 14-day incident rate is increasing. The 7-day incident rate is increasing. The 5-day average is increasing. Hospitalisations are increasing. And of course all of that is a concern. And we can see what's happening in the north with very high figures and huge pressures on our front line. And we really need to bear that in mind as we approach the end of the year. And as we know, in January, February, March, in any given year, it is a really difficult and challenging time for people who work in our acute services especially. And everything that we can possibly do to check ourselves, take personal responsibility to ensure that we do what is right over the Christmas period, we have to do. But obviously the HSE, the department and the government have a role and responsibility to give that message and to reiterate that message time and again. The virus has not gone away. It is still here, it is still spreading, and we cannot be complacent. We have to remain vigilant. Minister, I want to start to go under the bonnet of the plan a little bit and raise not what I see as concerns, but I suppose suggestions in relation to how we can give confidence to people that the vaccine will be rolled out as quickly as it can be. The document quite rightly says that the vaccinators will all be qualified medical professionals, and that is how it should be, because people need to have confidence in the administration of the vaccine and in the vaccine itself, and I would expect the vast majority of people will. So the question then is, how many vaccinators will there be? The question is, how quickly can we get all of the training done? Because the plan also says that these vaccinators will have to be trained. Maybe some of them won't need training, some will, but timelines here and urgency are really important. The plan also talks about mass vaccination centres. And you'll know, Minister, I published a plan myself in relation to providing a framework for how the vaccine could be and should be rolled out. And one of the things we called for was these mass vaccination centres. And we highlighted at the time in our submission that we felt that community settings, sporting facilities, for example, in sporting settings, would be a good place for these vaccination centres, because we do need to engender a community spirit and encourage as many people as possible to get vaccinated. We were told at the Health Committee there will be 15 vaccination centres. What we don't know yet is the geographical spread. That needs to be fair. And what we don't know is the level of staff that will be required to staff these centres. So my point is, the more vaccination centres we have and the more staff we have trained and in place, the quicker the vaccines can be rolled out and the quicker people can become vaccinated. And that's my point in terms of not raising expectations, because my understanding from what was being said by the experts is that it may not be even the summer of next year before we reach peak vaccination in this state. It could be closer to the end of next year. I would hope, and we would all hope, it will be sooner than that. And we all hope it can be done as quickly as possible. But that will come down, Minister, to you giving reassurance of how many doses of the vaccine we will get and when we will get them. And when you have that information is very clearly communicated to people. And second of all, when we get the doses, that the storage capacity is right, that the distribution and logistical requirements are right, and that the role of GPs and pharmacies and so on is also advanced and all of the work done. I met with GPs and I met with the head of the pharmacy union over the last number of days, and I know that they have other issues aside from the vaccine. I think you met them yourself recently about a new contract for pharmacists as well, Minister. But in relation to the vaccines, they need to be communicated with. They need to know what their role will be and when they will play a role in all of this. So when we have mass vaccination centres, for example, is it envisaged that GPs and pharmacies will also be administering the vaccine in tandem with these centres? Is that the plan? And these are the questions that will need to be teased out and answered, because one of the requirements that I asked of yourself, and it was something that you were supportive of anyway, was that the vaccine should be free. And that means that if it's been administered by GPs and pharmacies, that has to be worked out, Minister, and has to be worked out quickly. There cannot be any problems or delays or issues that arise that could have been and should have been foreseen. So now is the time to make sure we get all of that right. I also want to touch, Minister, on the need for public education, because I'm very supportive of vaccines. And as somebody who understands the importance of them and how they have all but eliminated many, many diseases in the past, and the crucial role they have played in not just elimination of diseases, but suppressing them in some cases, is extraordinary. And the development of vaccines and the development of new technologies and new research in this area has been phenomenal, and something that we should celebrate, and something that makes them as safe as they can possibly be, which is why I'll be at the front of the queue if and when the opportunity comes to be vaccinated. I and my family will be vaccinated because I want to play my part in suppressing the virus. But there will be people who will have questions. And I don't believe politicians should be the ones that give medical advice. I believe that medical advice should be given by medical professionals. And the medical professionals are people like Professor Butler, who I believe has done a first-class job over the last number of weeks in communicating a very clear, coherent message, and we need more of that. So public information is going to be really important. And if people have questions, let's not knock them. Let's encourage them to go to a GP, to get information from credible sources and from sound sources and reliable sources, as opposed to unreliable sources that we have seen in relation to other vaccines in the past. And let's encourage that, and let's make sure that they go to their GP and get factual information and equip them to be in a position then to take the vaccine. So my point is that is going to be an important part in all of this. But the final point I will make is this. I've been heartened, Minister, by the uptake in the flu vaccine this year. Even though we had more doses this year than previous years, there still wasn't enough because of the demand. That tells me that people will want to be vaccinated. That's what it tells me. So I think that we have a huge job of work to do. You have a heavy responsibility, and I want to wish you well in that, and your department and all of those who have done a lot of work in this area. And it is going to be the biggest challenge that will face us next year, and one that we collectively have to rise to. Gurb Magat.